Hey guys, this is Dr. Laura Ritchie. I'm a certified women's health and functional nutrition coach and doctor of physical therapy, and thank you for joining me on tonight's Self-Care Sunday, where we are going even into more depth on preparing for surgery. And if you missed part one of this Self-Care Sunday series, feel free to check it out on my Facebook coaching page under the videos there. We talked a lot about other tips and things to just really help you and empower you if you're dealing with a surgery or have an upcoming surgery or healing from surgery. And today I'm going to share even more tips and tricks with you. I'm having an upcoming hip arthroscopy, and so this is going to be geared more towards hip rehabilitation, but you could use it for anything as well. There's going to be tips for anybody having surgery that will come in handy too. The first tip that I have for you tonight is actually crutches, and we're going to talk about my favorite pair of crutches, and these are Mobi-Leg crutches. And what I like about them quite a bit is they're very ergonomic. So they are going to be a little bit more expensive than the standard crutch that you get, but I really do feel like it is worth it. And also, if you can get a script from your surgeon, from your physician, you can file that with insurance and they may reimburse some of that for you. So I think these, when I got them, were around $99, and I was reimbursed by insurance around 60, maybe even 80, I'm trying to remember, but they did cover some of this, so it's worth getting a receipt and filing that with your insurance and submitting that. But these are really great. I love that they are flexible, that they're not going to be hard under your arms, that they have these ergonomic handles, so the hand fits very well right into that area. And let's just talk a little bit about just how to make sure that your crutches are fitted well for you. And this is something that you want to get with a physical therapist just to double check that they are adjusted for you so that you're using them properly. And that could be a great thing to do, is set up an appointment to see your physical therapist before surgery, and you can start practicing with this. But just a few things when you're standing with your crutches, if you're letting your arms hang, this is going to be about where your wrists are a little bit. And you want to have about 2 to 3 finger widths here in between the top of the crutch and under your arm. That's important. Now, you don't want to do this. Don't hang on your crutches, guys. This can compress some really important nerves here, the brachial plexus, and that can affect the strength and the sensation in your arm. So you don't ever want to do that. Don't lean or just hang on your crutches. That's really not a good idea. And you want to have a little bit of bend in your elbow. So if you can see here, when I'm pushing down, there's a little bit of bend, maybe about a 15-degree bend here in my elbow. And that's how we want to start to kind of focus on adjusting the crutches to your height. And again, get with your physical therapist just to double check all of this. But I'm going to show you how to stand with the crutches, how to walk a little bit with the crutches. And this is going to be something that you guys want to practice ahead of time. Right after surgery, when you're on pain medication and things, is not the time to learn how to use your crutches. So we want to practice. So let me show you. We're going to come towards me a little bit and we're going to practice this. So the crutches always stay with your involved leg. And I'm going to be demonstrating on my right leg because I'm going to be having right hip surgery first. So we'll just say, if you're going to sit, if you're in a standing position, you would back up all the way till you feel the chair behind your leg. And you could even use that to balance you a little bit if it's stable or something like that. But back up to where you feel that chair. You got to know that chair is coming. Ideally, it has handrails that you can use to support yourself. You're going to kick out that surgery leg, so that leg's going to go in front. You're going to reach back with your hand for the chair or for something to stabilize you, your arm rail. Both hands are here, and the crutches stay next to that involved leg to support that surgery side. And you're going to lower down and go into a seated position here. Okay, to stand up, same thing. You're going to kick this leg out, kick the involved leg out so that you have room to go. Crutches are both in the same hand on the side, the involved side that you had the surgery. You can either push up from the chair or from a sturdy surface here to push up into standing. From there, you are going to transfer the crutch into each arm. So we've got our crutches on either side. And the most important thing, guys, is that the crutch always stays with the involved side. So it's always going to be there to support. So if we were going to take a step, crutches go first, then that involved leg, and then you're going to push with your arms and step with your other side. And as you get better at this, you can take bigger steps, you can get better. We call it a step. What I'm doing right now is a step 2. The left leg is coming right next to that right leg, but you can eventually do a step through as you get better, but practice this, guys. Now you want to talk to your surgeon because it depends on how much weight you can put through that leg. Some people, they can't put any weight through that leg. I can put 20 pounds. So I've practiced with a scale. I know what 20 pounds feels like. And you always, if you can put weight through your leg, you don't want to do this. You don't want to keep your toes up. That's going to shorten your Achilles tendon. That's not going to be a great thing to do. We want to work on that heel toe gait and placing just 20 pounds or whatever your restrictions are through that leg. So I'll demonstrate that one more time. We're going to crutches go first. We're going to step, push with the arms, and step with the other side. So I just wanted to show you guys that. Practice this. Practice makes perfect, right? And that's just a good tip to know, and you can definitely talk to your physical therapist, but practice this, guys. Practice getting up and down from the toilet. Practice getting in and out of bed. Practice all the things that you do throughout the day with your crutches, where you're going to sit, where you're going to stand. We want to prepare for this, right? This is like we're going into the Olympics, so we want to feel really ready for this. And if you're going to go backwards, so crutches go back a little bit, we're going to step back like this, and again, we would just back up till where we feel that chair behind us, and then we'd kick that leg out and sit. So I just wanted to demonstrate that for you because it's important. It's important that we know how to do that. And
we have a comment. Marla says, good info, Laura, and quick healing to you.
Oh, great. Thanks so much, Marla. I really appreciate that. Thanks so much. Yeah. So more tips and tricks for you guys. And we have to thank my sweet husband. He's my video guy today because for this, I can't just do this sitting in front of a tripod. So we're getting interactive, which is fun. So crutches, very important. Get them. If you're using a walker, make sure that you get a little tray table or a little cart in front, like a little basket, something to carry your stuff around. And if you're doing crutches, you'll want a backpack, something to keep your things with you because your hands are full, guys. We can't do a whole lot of that stuff. I've even seen little pockets, little things that you can attach to your crutches on Etsy where you can put your phone or different things. So look into those, but crutches are important. Assistive devices are important. So now for hips, there are restrictions that you can't bend past 90 degrees. Ideally, you always want to keep the hips higher than the knees. So sitting in higher chairs are going to feel much better for you. That's why a raised toilet seat is really ideal. You want to invest in one of those. But a hip cushion is really nice. Now they do make official medical hip cushions. Now these are so expensive, guys, and I really don't think it's worth the money. This was a QVC find on Amazon Prime, and this was $17.99, guys. So I highly recommend this. It's really comfortable. I used these before my periacetabular osteotomies, and I'm going to be using them again with my hip scope. It's nice and thick, so you're getting a raised seat with that. And I'm getting two, one to keep in my car and one to have here at home. Now I'm almost embarrassed to show you guys this, but this is my old one, so you can just see the difference. I've had this one for 2 years. It has gotten a little bit squished, but that was the purpose, right? So you can see why I ordered a new one. We want it to be working. But yeah, I use this quite a bit. So it is proven and tested. It works very nicely. And it's nice to have when you are traveling, when you are going anywhere that's not your home, because guys, once you have hip issues, you realize that a lot of those chairs are really low. So this is going to help you. Now, travel tip for you with getting home from the hospital. It's going to be challenging sometimes to back up, get into that car, and pivot your leg to get into that car. So here's a tip. You're going to take just a regular shopping bag. We're going to put our little cushion in here. They do have the Forever Comfy, and that's what this original one was, but the price went up. They used to be $19.99 and it was like $35. So QVC, guys, whatever you can find there. We just need a cushion to help us. So we're going to put this bag in here, and we're going to pretend like this is the car seat. So we'll put it in the seat here. And what this is going to allow to do is that plastic is going to make it much easier when you are transferring, especially initially right after surgery. If you're coming in at an angle, to be able to pivot and move your little bumper, move your bottom to get your surgical leg in and out. So if we're like thinking of transferring, this is really, really handy. And you could even put maybe just the bag on top and you could slide it out, because I don't want you sliding around when you're actually in the car. But that's just a little tip too, to really help make transfers in and out of the car much, much easier, is to have something to help slide. in and out. It will help with pain and everything, guys. So that's one tip for the car. Another tip is if you can get a little thing for your seatbelt that's padded or cushioned. This I got at Dollar Tree, but I'm sure they have them on Amazon and other places. But this goes over your seatbelt. So again, if you just had surgery on an area, and this could be your hip, this could be your abdomen, maybe you had surgery up higher in the chest area, but that seatbelt does not feel good, guys, right onto those incision sites. So something that can cushion that you can put there to just help, or even if you have a little pillow or something that can take up space to protect your incision site and your surgery site, that's another nice little tip. So this was Dollar Tree, but you could find some anywhere with that. Another tip, getting in and out of bed. You want to plan for this, guys. So you don't want to have to drag your surgical leg or your surgical side all the way across the bed, like with getting in and out of bed. So for example, my right side, I'm going to sleep on the right side of the bed because I can easily kind of get this one in and then bring that one up so that I'm not like bringing it all the way across. So plan for that, practice getting in and out of bed. Another tip is if you have some satin or polyester pajama pants, these are going to be ideal, and you may want to get a size up from what you normally do to accommodate all the padding, all the swelling that may happen, but these are going to allow for easy getting in and out of the bed with this. And if you have satin sheets, even better. You're just going to slide in and out of the bed. Do not wear flannel pajama pants with flannel sheets. It's a nightmare to try to get your leg. Mark is nodding at me because we learned that with one of the hip surgeries. This is the way to go, guys. Like easy breezy, just slides back and forth. All these little things that you don't know until you're actually doing that. So invest in some maybe satin sheets, maybe some polyester satin pajama pants. This is going to save you. It's just so helpful, guys. So things to plan for. You want some little slippers. So these are some fun slippers. These are NeuFoot. My dad actually got these for me in one of the gifts shops at one of the hospitals, but I like them because there's little grippies. This is not the time for flip-flops, guys. You always want to have stuff on the back of your heel covering you with the shoe because you don't want things to get caught in the crutches or the walker or anything, but these have little grippies and they're nice and stretchy, so they're going to accommodate for swelling because the swelling, guys, can be the whole leg, even the abdomen when we're talking about hips and pelvis. So just be prepared for that. It's okay. We talked about arnica. We talked about some other things in our last Self-Care Sunday, so check that out. But I like these because they're grippy. So they're going to allow you to have some grip, but they also allow for slide because we just talked about when we're walking, we have to slide that foot forward. When we're sitting, we have to slide that foot forward. So we want stuff with grip but slide, and it's a fine thing. So these are really nice, the NeuFoot. I also like Snoozies. Same thing, they have little grippers here, but they will also allow for sliding. These are machine washable. They're nice and fuzzy for winter time. We have snow here, guys. It was like 15 degrees this morning, so warm stuff too. Plan for that, but these are just little things as well. And with my first hip surgery, I brought tennis shoes to wear, and my foot was so swollen I couldn't get it on very well when I was leaving the hospital. So now I do like a slipper like this for shoes, and I may wear this in the airport, guys. We can just start a fashion trend. So things that are going to allow for post-op swelling, they have grippies, they're pretty good like shoes, they're going to protect your feet, and they're not slip-ons, but maybe rethink your shoes because again, you really can get a little bit of swelling with that. So something to just prepare for with what to wear, what to have on hand, just little tips of the trade, tips we learned from experience, right? So let's talk about a few other things. You want to get a little slip guard for your shower or your bathtub because this is not a time post-op that we want to go sliding around. So having something there to just cushion and keep you from sliding around can be really important. Another tip, it attaches to the shower or the wall there, and we like to get a handheld sprayer. So this could be nice. You could go to Lowe's and very inexpensively you can change out the shower head to have a handheld one, and ideally you have a shower chair or a transfer bench, and this will just make life so much easier, guys. And this is nice because I can put it on the wall and hang that little handheld sprayer right there so I have access to it and it's easy for me to reach. And this I got on Amazon. It was inexpensive, like less than $5. So little tips for the trade there. a little scratcher. And this sounds funny, guys, but when you're incapacitated, when you've had surgery, you may need to get to places and scratch things, and it's a little bit more challenging. So get you one of these. They're nice, they're fun, and you can have that, and it is extendable, so you can reach, say you got something on the bottom of your foot, you can scratch your foot, you can scratch your toe, whatever you need to, because remember, we can't bend. That's not gonna happen. So get your tools to help you with that. Ice, baby. After surgery. This is really important, guys. Ice is your friend. So if your insurance covers a cryotherapy unit like this one, we have Iceman here. This is making me think of Top Gun. Okay, so we have our cryotherapy here. That's going to be ideal. So talk to your insurance company, talk to your medical rep, see if insurance will cover it, and save these, guys. Never ever throw them away, because you never know when you'll need ice, or somebody in your family does, and insurance doesn't always cover these. So it's really, really important to just have these on hand, guys. Save them. Because insurance covered one for each hip with the PAOs. However, I was just informed that they're not going to cover them with this surgery. So I'm glad I have them. But if you got them, save them. And you could also look at Goodwill or thrift stores or Craigslist or something. I would recommend getting one of these if possible. They're just so handy to have. Now, they make the pads for the specific areas that you're doing. This is a hip pad. And they have right hip pads and left hip pads. But as you guys can see, it's designed to cover the area. This is going to be the cold part that's coming out that you hook up to the tube here. And that will go over the area and fit it very nicely like this. Now, word to the wise, never ever put this on bare skin, guys. You always need to have some kind of barrier, your clothing, whatever. This is not good. We don't want to cause like a frostbite situation or damage to the tissue. So always have that there. If you are sitting, and I have an electric recliner that I use to help me get in and out of after the hip surgeries. Always put a little towel or something on whichever part is getting the pressure where you're sitting. So if you're in the CPM machine, the machine that's bending and straightening your knee and your hip post-op, have that there, because we don't want to, it's on your bumper, it's on your little rear there, and we need to have this covered to just protect it. So that's another tip for you. Even though I had pants on post-op, it really made a difference to put a little washcloth on that back part there. And that could be very helpful, and the ice can really help with pain and swelling. So I highly recommend that as well. If you don't have this, or for example, we're traveling for surgery. So what we're gonna do is I actually looked for 2 very large ice packs that we keep in the freezer, and I actually have my name on them, and we have the hotel put them in their big freezers for us. I looked for the biggest one possible to cover the big area, like the hip. So since we're not going to be having an ice machine after surgery, I've got ice packs to tie me over until I get home, and I'm going to use it that way. So, and it's nice to have 2, because while one is in the freezer getting cold, you have another one and you can just continually swap. And that's really important, because ice is our friend. This is a really cool one. This is Cool Relief, and I got this one on Amazon. It's actually designed for the hip, which is really neat. So let me show you guys how this will work. So if you put it over your hip, and then it's got this little Velcro piece here to hold that in place. And then it's got one down here that you wrap around the inside of your leg to hold that just like that. This is very stylish, right, guys? But it's nice because it holds it right in place, and you can even use it, and you can crutch around with this on you, with your ice on you. So nice little handy things. You want a big ice pack depending on the area, but say you're having shoulder surgery, you could look for an ice pack designed specifically for that, to just help with convenience and having that on. And I recommend getting 2, one in the freezer, one out. A tip, if you have the cryotherapy unit, take your water bottles, and maybe not completely full, drink some of it, drink a little bit out, and freeze these. This is going to save you guys, because getting ice, filling ice is for the birds. This is just, your caregivers are not going to like you as they're constantly refilling ice in this. Mark is like, oh yeah, he knows about this. So these are nice. Get a couple of these, freeze them, and it makes life so much easier, guys, because then when it's time, when this gets too warm, you just pop a couple of those in there and you're good to go. And it's just way more convenient, so much easier than worrying about ice, buying extra ice. You can also get like little Tupperware containers and freeze them in different shapes, and you can kind of finagle stuff in that way. But The water bottles and having frozen water bottles is a game changer. And that way you're not constantly like pouring out the water, you're just swapping out the water bottles. So that is a very good tip that I learned as well. Now let's talk about how do we shower post-op? How are we going to do this? We mentioned the shower bench or the shower chair to have on hand for that. Now, what we can do, a couple things. Usually you're not allowed to shower right after surgery. I was reading my post-op protocol, right? Last week we talked about this, guys, having a little fun magical binder that's got your post-op protocol, all your things. See, I got my my little handicap permits here already in there. So I have those on hand, but my post-op protocols are in there, and it mentions that I cannot shower for 4 days. So tips for that. I really like these Alba Botanica, and these are just they're little cleaning wipes, but they're without the chemicals and the endocrine disruptors and the nasties. They're kind of upgraded. So this is nice. You're going to be sponge bathing for a couple days. So to have little wipes on hand makes it really easy, or you can use, soap in your washcloth or whatever, but the little wipes are handy to have. And also some dry shampoo. So I keep this in here because it's powder, guys. It can get a little messy. I keep it in a bag, but this is Argan, and it's a Cure is the brand here, dry shampoo. I got this at Natural Grocers. So again, I look for ones that don't have a lot of nasties or other things in there, but dry shampoo is your friend, especially after, if you can't shower for 4 days. So using that can be nice. Braiding your hair, getting your hair out of the way, all those things can be helpful. And if you guys haven't heard of Hilary LeMay, you want to check her out. She is on YouTube and Instagram and Periscope, and she actually has a do-it-yourself for making homemade dry shampoo without any of the nasties and using essential oils. So check her out. That's really cool. I didn't know that you could do that before, so I have this on hand, but when I run out, I'm just going to make my own because it makes life easier. So those are just good tips for that. Now, even once you can shower, you have to protect that surgical site, and that's very, very important. And you may not be able to completely immerse for several weeks until that incision site has completely healed. We want to reduce getting any type of infection or anything from that. So, ways for that, there's a couple. You can ask your nurse or surgeon. These are AquaGuard. Kind of like a fancy saran wrap thing that you can just put over your incision site and put that down and have that over there to protect you from that. If you have smaller areas like steri-strips or things, the Tegaderm film can work very nicely. Ask your nurse or healthcare professional about these and you can put it on. And these are nice because they create a nice seal, but they're not going to hurt when you take it off like some of the tapes and other things can. And they also make the Tegaderms in really large areas too. So depending on how big it is, like with a periacetabular osteotomy where they're cutting you open, you may need a bigger one. If you've got a scope, maybe a couple of the little ones, wherever those incision sites are, you can use it that way. But that can be a handy thing as well too. And also saran wrap works really well, guys. So you can put those on like over the incision sites, and then you just saran wrap your leg and around your abdomen really good. And you can get a huge thing of saran wrap, like an industrial size saran wrap, like what they use in restaurants at Sam's for very cheap. And you can just have your family members wrap you up really good. And then that way you can get in the shower and you make sure that you're not getting that incision site wet or anything like that. So stock up on some saran wrap, get it at Sam's, buy in bulk, and have that on hand for you. Here's a little tool. This is fun. So if you go to Lowe's, remember we can't bend over, and if you want to shave your legs, it's not a big deal in the winter, right? But in the summertime, that could be a thing that maybe you want to do, and we can't bend over if we're doing hip surgery or things. So if you get a dowel rod, you can see here, this is an oak dowel right there. It was like $1.48. Ask them very sweetly to cut it in half for you, to saw it in half. And I just took an old razor, and I put a new blade on there, but one that was older that I didn't really care about, that was kind of falling apart at the bottom here, and duct taped that to the dowel rod. And this way, you can shave your legs and you don't have to bend over and reach these things, and it's really nice in the shower. So just a tip for you there. This gets gross after a while, so throw it away and make a new one. But this is a nice tip that I learned from a fellow PT in the periacetabular osteotomy support group on Facebook, and it's awesome. So I always make one. And when you cut in half, I'll have one for one hip, and then I'll make a new one for the other hip, and ready to go. So that's an option too. Now, we talked about getting your post-op protocols. We talked about reading through those. And another good tip is to always fill out forms ahead of time. So I already have all of the forms for the physical therapy clinic that I'm going to be having PT at. I have them filled out. I have them in here completed. So when I go post-op, I just hand them to them. Post-op is not the time that you want to be filling out all of these forms and doing stuff. So the more that you can do ahead of time, the better. I also checked with the hospital. I filled out kind of the pre-admit forms all online, and also the anesthesia questionnaire online. So the more that you can do ahead of time, guys, the better. I printed it out just to have a copy in case I get there and there was some technical snafu, so I have everything there, but it's nice to be prepared and just streamline stuff to make it easier on you with that. So check and see if there's any forms you can fill out ahead of time. More little tools. It's nice to have a long shoehorn, because again, guys, putting on socks and shoes can be hard a little challenging after hip surgery when you can't bend over. So having a long one like this and just being able to use your foot and slide it in. This is a metal one. I got this off of Amazon, but it can work really nicely for that. It's a Lifestyle Essentials, but there's several, guys, that you can use, but just one with a long handle is very nice for that. Nice and convenient. You want some grabbers. And I promise you guys, I don't know what it is, but you may never drop stuff pre-op and after surgery. Once you're not able to bend over and pick stuff up, you're going to drop stuff all the time. You're going to drop the toothpaste, whatever it is. So your caregivers will love you for these. You can empower yourself. You can have tools to pick up stuff. You can get really good at this and really creative, but having a grabber is really handy. And I got a bunch of these at the Dollar Tree. And I have one in every single room in the house because you never know. So just stock up on these. And also a shoehorn can be really nice to have, or this was our shoehorn, a sock aid. So this is a really cool, another little assisted device. I got this one on Amazon, and it comes in handy with compression stockings if you're wearing those after surgery or any of those things. But you just put your sock on the end like this. And then you slide your foot inside and pull here, and it will go right onto your foot. Pretty magical. So for compression stockings, which can be a pain post-op, this is really handy. For socks, it's going to be really handy. So socks and shoe tips here with this. So invest in one of these. It's very, very handy to have. And last but not least, what to eat after surgery. We talked a little bit about that in last week's Self-Care Sunday, but just some more tips for you. I like having a really nice green powder. A lot of people are not super hungry after surgery, but we need to get those vitamins and minerals and nutrients in. So a clean green powder that doesn't have any gluten or soy or nasties in there. Organifi is a good one. I also like Sun Warrior, has some good green powders. doTERRA has Terra Greens. Those are clean. So those can be a nice option where you just have a little shaker bottle and you add your water and you're good to go there with your green juice. If you can find fresh green juice, that's awesome. And always look for a Whole Foods or where you can stock up on that stuff. I also look for a good clean protein powder. So this is Thorne. This is the MediClear. There's several brands that have clean protein powders. So I look for ones that don't have the gluten, dairy, sugar, soy, corn, peanuts, and eggs in there. JJ Virgin has some protein powders. Designs for Health has some. I'm trying to think of any of the other ones that are pretty clean. But you just want to make sure that you're staying away from some of those nasties. Sun Warrior has a clean protein powder as well. And you can try different ones and see which ones you like ahead of time. But doing that maybe with a little bit of water or almond milk or coconut milk and a little bit of fat. So something like some MCT oil or coconut oil, something like that. And just shake it up, or you can make your green smoothies. Any things like smoothies, soups, things that are going to take the load off of your digestive tract are going to be ideal for this. And last but not least, I love incorporating essential oils with this. So we have an On Guard roller. And the On Guard is the protective blend. It just really helps to support your immune system because we could need some immune support if we're going to the hospital, right? Am I right? Yeah. So this has a nice little roller here, and it's just for convenience. You can roll it onto the bottom of your feet, We have large pores there that allow for absorption. This is diluted already with our fractionated coconut oil. Really convenient. Throw it in your bag. Just have somebody roll it on the bottom of your feet. Start doing that a couple weeks before surgery, and then after surgery to support your immune system can be great. But I'm doing a whole class coming up, a virtual class on December 26th, just on essential oils to support you before and after surgery. So check that one out. But that is all the tips that I've got for you guys today. I hope you found this helpful. And if you did, please share it with people. I really want to get the word out. I want to just help support people along their journey with this. And yeah, please like my Facebook page. I would love that and really, really appreciate that. And I do private health coaching with people, and I really specialize in nutrition for pre and post surgery. So if you're interested in learning more, please reach out to me. Please send me an email. I'd love to help and support you along this journey. And I hope you guys have a great rest of your day. Oh, and one more thing before I forget, I'm doing a virtual Essential Oils of the Bible class. You can get all the information on my Facebook page under the events and join us that way. But I wish you guys a very happy holidays, a very Merry Christmas, sending you lots of love and light to anybody who is healing for surgery or preparing for it. You've got this. And check out the first part if you missed it. And I will chat with you guys next time. Bye.